CaPS stands for Cancer Patient Support Services. It's a special program, and our mission, again, is to help anyone dealing with the cancer diagnosis, to be an ally as well as a resource for information and offering the counseling to help people cope.
We have several programs in place, support groups for men, women, different ages, type of cancer specifically. I will say that the most popular support groups are the women's support group.
It's a fun group. Many people have a stigma about support groups, but these are groups that, yes, there's moments where they embrace their pain, but for the most part, these are, women that are here to demonstrate that they want to engage in a fight against cancer.
They make you feel like you're a sister, that you know that you can always count on them. You couldn't ask for a nicer group of women. I mean, to go through what you're going through, that's the type of people that you need.
We also have one-on-one or individual counseling, not only for the patients, but also for their families and their friends. In addition to that, we have inpatient counseling. That means that our counselors go in the hospital.
Well, basically, the counseling is supportive counseling, and what we do is just trying to help them to figure out better ways to cope, to identify what are the areas that are impairing their ability to function or to just thrive and go on with their cancer diagnosis.
Some of them are very stressed out, and it might not be the cancer that they have the issue. They have other social issues like losing their job, not having insurance, or maybe taking care of the family comes as a priority versus the cancer. We have programs like Qigong that helps them. It's a meditation and movement exercise that they do, and many of them say that it helps them relax and calm down.
And it's a stress reduction exercise that stresses breathing, posture, and relaxation. And I invite them to come and see what that's like. And it's easy to learn. It's not that difficult, and you can learn a routine within a very brief period.
It is a lot of mental concentration, looking inward, very, very slow movements, which is part of the science of Qigong. It is amazing the calmness and the energy that you can harness from this.
I believe our services are very instrumental, especially with the economy right now. I don't think it's enough to just offer the clinical care. We need to see the patients as a whole, and that's where CaPS comes in. When
I realized that the support groups are free, the Qigong training is free, and the 3-day cancer retreat is free, that's an amazing community service. The fact that it's offered and is available means that anybody can embrace it.
If we didn't have the types of services that we have and that we offer, then people would be on their own and be missing a lot in terms of the help that's available. If we didn't have it, people would be struggling more and probably have a higher emotional toll and more distress. We truly live our values and our mission to provide quality care for all in our community and to be preeminent because we really care. It might sound like a cliche, but we really care about our community, our patients, and their families.
People invite me into the most difficult times of their life when they're trying to decide whether they want to give up or they want to embrace hope. And we're building hope, and that's what we do through CaPS.